Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Heart failure is, as the term implies, failure of the heart function. The heart has basically two functions. It's a pump. It needs to pump out adequate blood, and it needs to receive blood. When the pump function is affected, that the heart cannot pump effectively blood volume out of the heart, we use the term heart failure. A second variant of that is when the heart is stiff and it can't fill properly. So then fluid backs up, the lung gets congested, and people have a hard time breathing.
So are there signs and symptoms that someone would exhibit if they are beginning to suffer from heart failure?
The earliest symptoms might be mild fatigue, having problems sleeping on your back, noticing some leg swelling. Later on, these same symptoms become more profound, and they are manifested by a decrease in your activity levels. In the extreme forms, people can't even breathe properly at the rest.
Is there one group of people or population that suffers more from heart failure than others?
85% of all heart failure patients are older than 65. It affects about virtually 5 million people a year, and it's about 500,000 new heart failure patients diagnosed per year. The most important antecedent, that is the factor that contributes to heart failure, is high blood pressure. 2/3 of all people with heart failure have had some form of heart disease before.
So are there various treatment options available to patients that may have heart failure?
It becomes a comprehensive assessment of these patients so that you address the risk factors for heart failure, the symptoms for heart failure, and prevent the progression of heart failure.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.